Welcome to the last video in this first lesson that more or less focuses on the heart and serves as an introduction to the cardiovascular system. In this video, we're going to talk about the way that the blood is pumped out of the heart, what the relevant parameters are, and you will be directly responsible for only a part of this, basically the first part. You should know that the cardiac output is the amount of blood leaving the ventricle per minute, and normal is about 5 liters per minute. The cardiac output is equal to the heart rate times the stroke volume. Okay, that is the rate at which the heart pumps per minute, so you can literally count the number of times you contract and relax. And then the stroke volume is the amount of fluid ejected every time you contract. So of course the number of times you contract and the amount ejected every time you contract will give you the blood flow per minute. Okay? The normal heart rate about 70, and it's controlled by the autonomic nervous system. The normal stroke volume about 70 to 75. If you take a normal heart rate times a normal stroke volume, you'll get 5,000 liters per minute or 5 liters per minute. This is all I expect you to study and remember directly from this video. However, I do want to take you forward so you're familiar with some of the things that alter the stroke volume in particular, because those things may very well come up fairly early. The stroke volume is controlled by the preload. That is the amount of blood in the ventricle right before the ventricle starts to contract. The more blood is in the ventricle, the more the walls stretch, and the more the walls stretch, the harder the force of contraction and the higher the stroke volume. So a higher filling pressure or a higher filling volume means a higher preload, and that means a higher stroke volume. The afterload is the pressure against which the heart contracts. So if you have high blood pressure, that means your ventricle is working harder. It's pumping against that pressure, trying to shove blood out against a high pressure in the arteries. A high afterload reduces stroke volume. Inotropic state or contractility. I like this term. This is the one that you will most often hear. You should recognize the difference between contractility and force of contraction. All three of these things increase force of contraction and will increase the stroke volume because of that. But this is a special subtopic of that. In other words, it means special things. And basically, contractility or inotropic state, that means that that is determined by things like the amount of calcium in the cytosol. If you give a drug that increases the calcium in the cytosol of a cardiomyocyte, it will contract with more force. We say there's an increase in contractility. You can have an increase in the number or a decrease in the number of functional myocytes. Let's say I cut off oxygen to a portion of your heart. That cuts down the number of functional myocytes because the myocytes in that area aren't going to be functioning very well. That would be a decrease in inotropic state. That would decrease stroke volume. Coronary artery supply, that's related to this. If you cut the coronary artery supply, the myocytes that are in that area that are still functioning aren't going to function very well, and that is going to be a decrease in contractility. So the typical question that I get from students is, how do I tell what is a change in contractility or inotropic state, and how do I tell what isn't? And the answer to that question is, if you know what preload is, which students typically know and have no trouble with, that's an increase in volume or pressure in the ventricle, stretching the walls. If you know what afterload is, which is like high blood pressure, if it's not one of these two things and it's changing the stroke volume, that means it's a change in inotropic state or a change in contractility. Okay? And recognize that these are the kinds of things that change contractility. All three of these things change the force of contraction. So don't get the two mixed up. Okay? All right. So let's think about our cardiomyopathy patient. Her blood pressure is 112/76. That's low. Her heart rate is 131 per minute. I just told you normal was 70. So that's pretty high. Her resting heart rate, pretty high, okay? High. So let's assume that her cardiac output is low or normal. She's a heart patient. That's a pretty good assumption. She's probably having trouble with her heart. Her cardiac output might be a problem. If her heart rate is high and her cardiac output is low to normal, what does that tell you about the stroke volume? Cardiac output is equal to heart rate times stroke volume. Cardiac output low, heart rate high. What must be true of stroke volume? Must be low, right? This times this equals this. If this is low and this is high, this must be low, okay? And that is the case. Cardiac output, heart rate times stroke volume. This is high, this is low, or even normal. This must be low in order for this to be low or normal if this is high, okay? That's why that relationship is important. That's why you need to know it, okay? Our patient's ventricular muscle is in a negative inotropic state. That means her muscle is not functioning very well, and that has reduced her stroke volume. Okay? All right. That is all I have for you. Thank you for your attention for this video and for this lesson, and we will move on to the next lesson when you're ready. Thank you.